Okay, welcome to Duke Spine Institute live stream spine surgery. It's now Tuesday, February 25th, 2025. Our last surgery of the day. We've done 4 surgeries so far. This is number 5. We've broken up a few of our surgeries into multiple streams because they're different types of surgery, so that way we kind of keep it organized. This patient has 2 painful discs, a painful SI joint, a painful piriformis muscle. We're going to fix all 3, 2 discs, SI, piriformis, all on the right side. Lay still, you're doing great. I'm going to start by giving him some numbing medicine under the skin so I can make an incision, place a needle. Just lay still, that's numbing medicine. You're doing great. Everything's okay. During the surgery, feel free to ask questions. Just type them up. Henry will ask me your questions and I'll answer them for you. We'll start by fixing his 2 discs. We're going to call this the Duke laser disc repair. That's the name of the procedure. It's a transforaminal endoscopic annular debridement, removal of the herniation, decompression of the nerve roots if there's stenosis. But the main purpose of the surgery is get the cause of the back pain out of there, which is the annular tear and herniation stuck within the tear. Okay, we're going to get started. Henry, since this patient has so many different causes of back pain, let's share with the audience all those different causes that there are. There are about 30 things that cause chronic back pain. Let's take a look at the 30 things that cause chronic back pain.
Of course.
I'm Dr. R. Duke Majan with the Duke Spine Institute, and we're going to discuss 30 causes of chronic back pain. Chronic back pain is back pain that lasts longer than 6 weeks, and there are 30 causes of chronic back pain. The most common cause is going to be a disc injury. Disc injuries such as disc herniations, disc bulges, disc ruptures, degenerative disc disease account for 86% of chronic debilitating back pain, and they are totally fixable with the proper treatment. The best treatment for disc injuries is Duke laser disc repair. Let's take a look at the 5 lumbar discs that can be injured. The most common disc to be injured is L4-5, followed by L5-S1, then L3-4. The L1-2 and L2-3 discs are far less commonly affected. Next, we have facet joints. Facet joints are small joints located behind the discs in the back of the spine. There are 10 facet joints, each paired left and right, L1-2, L2-3, L3-4, L4-5, and L5-S1. The most common facet joints to cause chronic back pain are L4-5, followed by L5-S1, followed by L3-4, in that order. After the facet joints, which account for approximately 10% of chronic back pain, we move on to the sacroiliac joint. The sacroiliac joint accounts with the piriformis muscle for approximately 4% of chronic back pain. The sacroiliac joint is a joint located between the tailbone or sacrum and the iliac bone. There is a left and right sacroiliac joint. In this diagram, you can see the joints turning red, indicating inflammation and pain either in the left or right sacroiliac joint. These sacroiliac joint injuries and pain can be treated most effectively with the Duke plasma rhizotomy of the SI joints offered at Duke Spine or Duke Joint Institute. The 4th most common cause of chronic back pain is a piriformis muscle injury. The piriformis muscle is located in the buttock, and there is a left and a right piriformis muscle. The muscle gets torn, unfortunately, when people bend the wrong way. This usually occurs in patients with orthopedic problems such as hip pain, knee pain, or back pain. By bending improperly, they put the muscle under too much stress and they tear the muscle. The torn piriformis muscle causes severe debilitating pain in the top of the buttock. There is a left and a right piriformis muscle, and this can be treated most effectively with the Duke piriformis muscle release. This is performed percutaneously with a 4mm incision. The sciatic nerve does run through the piriformis muscle, and many patients with piriformis muscle syndrome also have sciatic sciatic pain down their legs with pain, numbness, tingling, and weakness in the leg that's affected on the side of the piriformis muscle. Piriformis muscle can be treated with injections such as steroids, Botox, PRP, or stem cells. However, those injections always wear off and the patients end up coming back with the piriformis muscle pain that reoccurs. The most definitive treatment for permanent relief of piriformis syndrome is a piriformis muscle release. Next, injuries to the bones of the spine, such as the vertebral bodies, with trauma can cause fractures of the vertebral body. Vertebral body fracture is diagnosed with X-rays or CAT scan or MRI, and they're treated with injection of cement into the vertebral body. Looking at the vertebral bodies, the most common to be affected is L1, followed by L2, then L3, L4, and L5. The sacrum can also be fractured. Finally, the coccyx is the last cause of chronic back pain. You can see in the diagram the red coccyx at the bottom. This comes usually from an injury where the patient falls on their bottom, sustains pain at the tailbone, and this can be treated with injections of the coccyx ligament. These are the 30 most common causes of chronic debilitating back pain, the most common being the disc, causing 85% of chronic back pain, followed by the facet joint, causing 10% of the chronic back pain, followed by the piriformis muscle and sacroiliac joint, which cause 4% of chronic back pain, totaling 99% of chronic back pain, which is totally fixable and curable with the right treatment. Thank you. I'm Dr. Duke Machen. Thanks for joining us. Okay, while you guys were gone, he's squirming, but I'm okay with it. He had 10 out of 10 pain in his discs when we tested them. And right now we're entering into the L4-5 shot. We're going to fix this one first. So just in case you've never seen it, the tube that we do the whole surgery through is 7 millimeters across, and it has a fenestrated end. We're going to slide this guy down over the dilator, and then we'll take the dilator out. If you have questions, feel free to ask. You saw the video just a moment ago, the 30 causes of back pain. That's a nice animation showing you that there are 30 things that cause back pain commonly. If the surgeon doesn't find the right cause, then you're not going to get rid of your back pain. So your doctor has to identify the actual cause of pain. Duke Spine Institute does that for every one of our patients that we treat. We start with the diagnosis. That's always the first step. Once we have the diagnosis, we know exactly what needs to be done treatment-wise, because we have the best treatments in the world for each diagnosis. I'm not seeing irrigation or suction. I don't mind him moving. Just keep him safe. All right. You have any, it could just be reflex. Henry, do you have any questions?
Yes, we have a question coming from Smarzig on YouTube.
Hi, Smarzig. Welcome back.
Saying, hi, it's me again. I misspoke on an earlier comment instead of collagen. What about glycine to build up collagen, which is an amino acid, and I suppose you would take it on an empty stomach?
Yeah, great question. So glycine is an amino acid. There's 21 amino acids, I think. I can't remember. And by the way, when I studied biochemistry many years ago, it may be a different number today, but there were 21 back then. So collagen is made up of more than one amino acid. Amino acids are building blocks. They're like little, if you're making a necklace out of little, what do you call it? The little colorful beads, little bead necklace, and you have 21 different colors of beads. Now, the collagen necklace is made up of, let's say, I don't know, 12 different colors. Just having one of the 12 colors doesn't really help. You have to have all 12 in order to build a collagen necklace. So, what are the amino acids needed for collagen? There's many different types. And there's many types of collagen. Like there's literally, I think, 12 or 14 different types of collagen now. And What is the predominant collagen used to heal the disc annulus? That's a great question. I don't have an answer. The point I'm trying to make is I wouldn't focus on one amino acid. I would focus on all of them. If you're going to do anything to build up your disc after the surgery, I would have a well-balanced diet, vitamins, minerals, protein, carbohydrates, fats, vegetables. Have it all. Just eat normal. Our bodies are designed to accept all types of food, processed food within our intestines and within our gastrointestinal tract, and extract the nutrients. So I wouldn't worry so much about isolating one type of nutrient, vitamin, mineral. I would just do them all. Go have a pizza, pepperoni pizza. And then you'll have everything. You'll have vegetable, carbohydrate, fat, protein. You'll have everything. You know, there was a nutritionist named Paul Saltman, one of the greatest biochemists I've ever met in my life. He taught me at UC San Diego. He was a professor emeritus. He was a professor emeritus of biochemistry. He was a biochemist. He taught nutrition and biochemistry. He was famous because he was a nutritionist. And he taught a course, Advanced Nutrition, at UC San Diego, which I took, and I learned a lot. But he always said the perfect food was pizza. And he's right, because it has all the food groups and enough of them. So don't try to be so restrictive. And he was never in favor of popping vitamins. He was always about eating a well-balanced meal. I agree. I share his philosophy.
We have a couple more questions.
By the way, here's the tear in the disc. You guys see it?
Yes, we do.
The white is the annulus. The blue is the herniation. There's more annulus. The tear is right in the middle between the two. So we debride the tear with the laser. By the way, for those of you who don't know, the laser fiber, the glass fiber there, not the blue part, but the glass part, that is 1 millimeter wide. That is the diameter of that fiber. Just to give you an idea of what we're looking at here, that's how small everything is. Remember, the inside of the metal tube right here is around 5.5 millimeters. So half a centimeter. And that fiber is 1 millimeter wide. Yes, I'll take some more questions.
Next question is coming from Karsten on YouTube.
Hello, Karsten. Welcome back.
Asking, is the reason for the lack of ability to heal a tear in the disc that there is too much instability in the disc due to too much movement in the facet, so that too much constant movement will not allow healing?
I don't need to hear the rest of the question. Karsten, no. The reason the disc doesn't heal is, I've already told you, number one, if you don't have the laser debridement that I'm doing, you're going to have this blue stuff stuck in the tear, and the blue stuff prevents the tear from healing. Okay? It's like trying to close the door to your house when there's a dead body laying across the threshold of the door. You cannot close the door with a dead body there. You have to move the dead body. You have to get rid of it so you can close the door. I use dead body, but pick whatever you want. Alligator, platypus, dolphin, doesn't matter. There's something physical blocking the door from closing. That is this herniation right here. The only treatment in the world that fixes that is the laser. My laser surgery is the only treatment in the world that allows the annulus to heal. Now, once you have cleaned this stuff out, like I'm doing, you've gotten rid of the herniation, the scar tissue, the inflammatory tissue, then what will allow the disc to heal? I don't know what you did, but you just got rid of our irrigation for about a second without telling me. I'm sorry, without telling me, which you're not supposed to do, and you created a situation that was potentially dangerous. All right? Because I've never seen the tube go dry. Any reason why the tube went dry? I'm sorry? Can you understand what she's saying? You guys should never change what we do unless you get permission from me or Luis. All right, you guys see the tear right there?
Yes, we do.
Okay, that is, the blue stuff is the stuff that keeps the tear from healing. The only way to get the tear to heal is to remove it with my laser. There is nothing else that works. And you have to see it to remove it. You can't just stick a laser in here. So you got to have the endoscope, you have to be inside the disc, inside the tear, and you have to use a laser. That is the Duke laser disc repair. If you do that, you're doing my procedure that I pioneered. Okay, so this is the only way in the world to get a tear to heal. Now, once you do this surgery, then the patient's tear will heal, but it heals slowly, not because of anything you're mentioning. It heals slowly because what's missing? What do you notice is not here while we're operating? The answer is blood. There is no blood. Why is there no blood in the disc? Because the disc has no blood supply. The inner part of the disc has zero blood supply. The annulus is the only part of the disc with a blood supply, and only the outer half of the annulus has a blood supply. So all healing must happen from the outer annulus. It's very, very slow to heal because there's no blood supply. That's why. For no other reason. Unless you want to add a blood supply to the disc, you're going to have slow healing.
We have a couple more questions.
Sure.
Next one coming from...
Before we take the questions,
Of course, yes.
let's show the audience, why do discs hurt when they get injured? What is it about a disc injury that causes so much pain?
Of course.
Disc injuries start with an annular tear, damaged nucleus. Pulposis herniates into the annular tear. The herniation triggers an inflammatory response within the annular tear. The inflamed annular tear generates pain signals. For more details, please visit our website or call us at 1-800-FIX-MY-BACK 349-6922.
Okay, welcome back. So you can see from our video that the pain in the disc comes from this tear first happening, and then this blue stuff, which is stained blue by my dye, which is actually nucleus pulposus, the jelly in the middle of the disc, squeezes out through the tear and gets stuck inside the tear. Once inside the tear, your inflammatory system, when it gets to the outer half of the annulus and the blood supply, sees it and attacks it. And that attacking is what causes all the pain. It's a constant attacking. It never stops. And the more you herniate, the more your inflammatory system responds and attacks, causing pain in your back and scar tissue and calcification. But you can see the tear right there. This patient has had back pain for many years, and 5 years has been really bad, and it's because of this tear and the inflammation. You guys see the pink color to the tissue? That we're getting to the outside of the tear where the blood supply is. That's why it's pink. Otherwise, it'd just be white or blue. The fact that it's pink tells me we're getting a blood supply. We must be getting to the outer part of the disc where the pain fibers and the blood vessels are.
Next question coming from Smarzik, once more on YouTube,
All right, Smarzik, hi.
asking, have you found smokers or vegetarians take longer to heal?
You know, Smarzik, that's a great question. Here's the thing. I've been doing this surgery for 20 years. I have no way to assess whether the disc is healed. There is no way to assess it. You can get an MRI, you can get a CAT scan, you can get an X-ray, you can get any type of test you want, but none of them will show you whether the disc is healed or not. They just don't. There's no way to know if a disc is healed. So I have no way to know when the disc is healed. All I know is that patients who do too much too soon end up re-herniating. And the re-herniation rate's about 1%. 1% of our patients will re-herniate and have symptoms, and they need more surgery as a result. Now, we haven't had a re-herniation in many months, but I'm sure we're due for one. But in the last 20 years, we've done 2,500 of these surgeries. We're now more than 2,500, but we've had about 25 re-herniations. Really, we've had 24, but I'm sure we're due one soon. So for 20 years, we average 1% of our patients re-herniate, 1%. Now, the re-herniations always happen early, like within the first 3 months of surgery. I never see them happening after that, which tells me people's discs must be healing. So I tell everybody to take it easy for the first year, just to be conservative. But we have no way of knowing when your disc heals versus somebody else's disc heals, because there is no test as to whether or not the disc is healed. Or not healed.
Next question is coming from the Classic Car Nut on YouTube.
We haven't heard from the Classic Car Nut in a long time.
It's been a while.
Welcome back.
Asking, are lumbar epidural injections a waste of time for chronic lumbar radiculopathy? And what about nerve blocks as well? Thank you.
Yeah, so are lumbar steroid injections a waste of time for radiculopathy? The answer is yes and no. They are, because they're never going to fix the problem. But let's say you're working in your job and you have no vacation time and it's a really busy time of the year and your boss needs you to work. But in 2 months from now, you can, have some time to go have surgery done 2 months from now. Well, an epidural may be a good thing to do right now to make you feel better for the next 2 months until you can have your definitive treatment. But epidurals never fix the problem. There is no fix to this problem except surgery. Period. Shots, pills, acupuncture, therapy, chiropractic, physiotherapy, occupational therapy, psychotherapy, whatever therapy you want to call, whatever shots you want to do, whatever procedures you want to do, nothing works except for 2 things. The laser surgery you're watching right now, or a fusion with decompression, where you're taking the disc out and you're putting a cage, metal screws and rods, holding everything together. Those are the only 2 treatments in the world that work in my experience that I've seen. Even artificial discs have a tendency to leave behind pieces of herniation that cause symptoms and pain, like radiculitis, like you're talking about. So artificial discs are not a good option for decompressing a nerve root, because the artificial discs are done through the front of the spine. You can't see the back of the disc. You can't see where the nerve root is in the back of the disc. You can't see if you got all the disc out. It's not possible. So a lot of patients who get artificial disc put in still have radicular symptoms and stenosis and impingement on the nerve root, because the surgeon never did a decompression of the nerve root properly. So if you want to have a good decompression and a good result, this surgery you're watching right now, laser surgery, Duke laser disc repair, or transforaminal lumbar interbody fusion with osteotomy and removal of lamina and facet to decompress the foramen and nerve root, that is the next best option. But it's only those 2 surgeries that adequately decompress nerve roots in the lower back. Microdiscectomy does not, laminectomy does not. No other surgery or treatment does. They all do a very bad job.
Classic Car Nut has a follow-up question once more on YouTube asking, how about injections as a diagnostic tool? Thank you.
Injections as a diagnostic tool, that's a good one. I think if you have a good epidural done and you get good relief, it could be an indication that you're dealing with radiculitis but it's not guaranteed, because if you have piriformis syndrome, which has nothing to do with the spine or nerve roots, and you get an epidural, your piriformis syndrome symptoms are going to get better, because steroids help all symptoms of inflammation in your whole body. If you have infection in your eye or inflammation in your eyeball and you get a lumbar epidural steroid injection, your eye will feel better. Your headaches will feel better. Whatever it is, any inflammation in your body will feel better. Why? Because the steroid injection in your spine doesn't stay in your spine. It goes into your bloodstream and it actually travels throughout your whole body. So wherever your inflammation is, that epidural is going to help it. Okay? So it's not specific enough to the lower back. A lot of people think that shots in their back stay in their back. They don't. They travel throughout your whole body, and they have a systemic effect. So I don't think the diagnostic value is that good of shots. Now, you can do a diagnostic facet joint injection with numbing medicine, Novocaine, lidocaine, Marcaine, block the facet joint and see if that takes pain away. You can do a diagnostic SI joint injection. You can do a diagnostic piriformis muscle injection. All of those diagnostic injections are good for diagnosing, but an epidural steroid injection is not. An epidural steroid injection is non-specific. So, diagnostic facet, diagnostic SI, diagnostic piriformis, yes, 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 very good for diagnosing, because you're not putting steroids, you're putting a local analgesic which goes right where you put it, and there's no systemic effect, you know. All right, we're done with this disc. We're at the back of the disc now. You can see the epidural space, all the fat. We're outside the disc. We're looking at the tear. It was a big tear, top to bottom. But remember, the inside of this tube is 5.5 millimeters, and that tear is smaller than the inside of the tube. That's around a 3 millimeter tear, maybe 4 millimeter tear. That will heal, but it will take 9 months to a year to fully heal. We cleaned out the tear. We got rid of the herniation that was stuck in there. And now the body can start healing that tear. It was never able to do that before. It was trying, and that's why the patient had back pain. The pain came from his body's attempt to heal the tear. That's what caused the pain. The body's attempt to heal the tear is called inflammation. Have we shown the video on how the Duke laser disc repair helps the body heal the tear?
Not yet.
Let's do that.
Copy that.
Disc injuries are a common cause of chronic back pain. The inflamed annular tear causes back pain. A 1/4-inch sized skin incision is made. A small tube is inserted with no damage to the bones or soft tissues. The laser removes the herniation and debrides the annular tear. The annular tear heals on its own after the procedure, which can take up to 12 months. For more details, please visit our website or call us at 1-800-FIX-MY-BACK 349-6922.
And welcome back. We are starting on the number 3-4 disc on this patient who has 2 painful discs, 3, 4, 4, 5. And the pain is coming from tears in the back of the disc called annular tears, specifically posterior, meaning back annular tears, versus anterior or lateral tears that don't hurt. So a posterior annular tear is the cause of chronic debilitating discogenic back pain. And you saw the video just now how we fix those using our endoscope and laser. The procedure has a name. It's called Duke laser disc repair. This patient came from Ohio to have this procedure done. He's actually a race car driver and he does other things, but I can't tell you too much about him because I don't want to give away his identity. That said, he is very keen to get rid of his back pain. So when I did his evaluation, I figured out his pain was coming from his discs at 3, 4, 4, 5 that were damaged, plus his SI joint, plus his piriformis. And he chose to have all of them fixed. Now this blue stuff here is the herniation. Herniated nucleus pulposus. What is nucleus pulposus? It's the middle of the disc. It's not a jelly. We call it a jelly, but it's not really a jelly. It's a firm, it's like silicone. It's firm and compressible, and it's really the embryological remnant of the notochord, and it's hiding away in the middle of the disc, hiding from your body's inflammatory system. Why? Because your body has nothing else it can do with it but encapsulate it, right? You can't eject it. I guess you can dissolve it, but your body is unable to dissolve it. And so here, his body has been trying to dissolve this stuff for a long time. 5 years, maybe longer in his case, based on what I'm seeing. But nobody can dissolve their herniation. So people think they can dissolve their herniation because they're told they can do that by physical therapists, chiropractors, pain management doctors, nurses, surgeons, whatever. But nobody can dissolve their nucleus pulposus. Not at any time. If you could dissolve your nucleus pulposus, then why would you have discs? I mean, after all, if you could dissolve it, then your disc would just dissolve. So what makes you think you can dissolve a herniation? A herniation is your natural part of your body just stuck in a place it's not supposed to be. If you have a herniated intestine in your belly, are you going to dissolve your intestine? No. It's ridiculous. So the whole notion that you can dissolve away your herniation is so stupid. Yet, so many people believe it, and they're taught it by healthcare professionals. I mean, shame on the healthcare professionals. How are you going to dissolve away your herniation? It's a ridiculous notion. I mean, what part of your body do you dissolve away? Help me. Anybody? Can anybody think of any part of your body that you can dissolve away? Dissolve fat? Really? You're so funny. Nikki, I don't pay you to think. All right, so do we dissolve fat? Is that accurate? Yes, we dissolve fat. Fat is a molecule. It's an energy source. Of course we're going to dissolve it. But do we dissolve fat cells? No. Our fat cells that store fat are never dissolved away. So we always have the same number of fat cells today as we did when we were skinny or when we were super fat. It doesn't matter. What matters is how much fats are being stored in them. Fats are just an energy source. So we don't dissolve our body away. We dissolve fat. Fat is an energy source. So that doesn't count. Sorry. What are you going to say? We dissolve water away too? Because we're 70% water. We dissolve water when we're dehydrated? No. We're not dissolving water. Are we? Luis? Thank you. So we don't dissolve any part of our body away. So the whole notion we dissolve away a herniated disc is ludicrous. Go ahead. You people have been lied to. When you're told by your therapist, go to physical therapy with me for 6 weeks, pay me, whatever, $50 a visit, and we'll dissolve away your herniation. They're lying to you. Bold-faced liars. Okay? Look at how hard it is for me to take this damn herniation away. It takes all this laser energy. Okay? Laser energy to break it up and get rid of it. So this whole notion that your body will dissolve it away is just dog shit. All right? So stop believing people's nonsense. Look at the inside of that tube right there at the top at 12 o'clock. You guys see that?
Yes, we do.
You know what that is? Those are laser blasts. You see them? Those etches in the metal?
That we do, yeah.
That's how much energy we're delivering to, quote unquote, dissolve away the herniation. A lot of energy is being delivered to break up the herniation. So we're giving you all this energy to get rid of the herniation. You really think your body is just going to dissolve it away? No, of course it isn't. But that's what these people want you to believe. Why? Because they want you to pay them money to go to their therapy or chiropractic or acupuncture and lie to you and tell you they're going to dissolve away your herniation. That's how they make a living. Well, I'm here to tell you otherwise. Got a pretty good sized chunk there. Yeah, it's hard to remove herniations. Besides, you want to wait 1,000 years for it to dissolve away? I don't. Let's go get that thing. We can dissolve it away for you in an hour. Right? Unless you plan on living as long as Methuselah, you don't have the time to dissolve away a herniation. Now, there was a way to dissolve away herniations that we invented as doctors years ago, and it's called papaverin. How many of you have heard of papaverin?
Yes, the chymopapine treatment.
Chymopapine, right?
That caused a lot of problems.
Yeah, people got paralyzed from that treatment. Not my patients.
A lot of neuritis, right?
Yeah, myelitis, transverse myelitis, inflammation of the spinal cord. The point I'm trying to make is you can dissolve away a herniation if you put a chemical inside. This is really an enzyme that went in the disc. They injected it, pain management doctors. But then the FDA banned it because people were becoming paralyzed from the treatment. We've never had a patient paralyzed from our treatment, ever. Last level, yeah. But be aware, there's a lot of phony crooks out there, and they'll tell you whatever they want to tell you to make you believe that they've got something for you. I love this Tommy Copper stuff now on TV. I watch Fox News, I gotta tell you. I don't think a single commercial on Fox News, primetime, is actually legitimate. Every single commercial they have, I'm looking at it, they're talking about, try this pill, it's gonna cure your pain. I'm like, that's bullshit. There is no pill that cures pain. They're so full of it. And everything they advertise now is like basically a giant lie. I mean, I like Fox News because I like to hear the truth, but at the same time, I can't stand their commercials. They're just full of lies. All right, what questions do we have?
Next question coming from Lance on YouTube.
All right, Lance on YouTube, welcome.
Asking, if someone had Duke laser disc repair done on 2 or 3 levels in the cervical and also many herniations in the thoracic, how long after their cervical surgery can they come back to do the thoracic?
I would say it's safe to come back after 6 weeks and have the thoracic done. 6 weeks would be my recommendation. 6 weeks of recovery. That's assuming your recovery is normal, no problems, no issues. All right, next question.
At this moment, no current questions, but we do have a comment coming from the Classic Car Nut once more on YouTube.
Sure.
On their follow-up on their injections question, saying, interesting, thanks again. Tell the doctor I won't ask you about flossing or you do the flossing again.
It was you that got me to floss. My flossing is horrible. I mean, my dentist likes that flossing, but my dance flossing is just abysmal. I was not blessed in life with singing, and I was not blessed in life with dancing. And I'm like the worst singer and dancer you'll ever meet in your whole life. I'm so bad. But I do know how to fix spines. That's one thing God gave me. Thank you. All right. Yeah, I'm sorry. I'm not going to floss for you right now. I am using the laser. It could get dangerous. Thank you, though, for joining us. Henry, we've shown everybody the 30 most common reasons people get chronic back pain.
Yes, sir.
We've shown people how a herniated disc causes pain.
Correct.
Or a disc injury, I should say. We've shown them how we fix it.
Correct.
Since this patient's going to be having some more procedures after this, and we got a few more minutes left on the surgery, we have no questions. Let's show the audience how we fix piriformis, torn piriformis muscle with pain.
Of course.
A piriformis muscle tear can cause lower back pain and sciatica. A piriformis muscle injury causes a tear, in which piriformis muscle inflammation causes back pain. And also, piriformis muscle inflammation may cause sciatic pain. The best treatment for piriformis muscle syndrome is the Duke piriformis release. From there, the piriformis pain is permanently eliminated. The advantages with the Duke piriformis release is that it's an outpatient procedure, which would take up to about 30 minutes. Minimal bleeding and pain after the procedure with an immediate recovery and return to work the next day, as well as a 99% success rate with permanent pain relief with a single treatment. For more details, please visit our website at www.dukespine.com or call us at 1-800-FIX-MY-BACK, 349-6922.
Okay, great. You can see that piriformis syndrome is essentially a tear in a muscle in your buttock called the piriformis muscle. It attaches from the tailbone over to the top of the hip. Once it's torn, it never heals because, well, the only way to get it to heal is to lay in bed for 3 months and not move, but nobody can do that. That means you can't even use a bedpan. All right, we're getting to the outside. Look at the pink tissue right there. That is inflammatory tissue I've been telling you about. It's really most apparent and like present in the outer part of the tear where the outer annulus is, because this is the part of your disc that has the blood supply. Remember, the outer half of your annulus has the blood supply of blood vessels. So you can have inflammation here that you can't have normally in the inner part of your disc. But of course you can get it in the inner half of your annulus because the blood vessels grow. They can grow. They can grow into the inner half of the annulus. That's something a lot of people don't understand. How do blood vessels grow? Well, they grow with what's called cytokines, which are growth factors for endothelial cells. Endothelial growth factor, EGF. And these cytokines are released during inflammation. So all of the inflammation that happens in your body causes cellular release of cytokines, which then cause reactions to occur, biochemical cellular reactions. In the case of endothelial growth factor, you have the stimulation of new blood vessels forming. What? Anyway, you also have nerve growth factor, I heard, which is the ingrowth of new nerves. So this inflammatory tissue right here that I just zapped, that has tiny little nerve fibers that are pain nerves that are very sensitive to pain, which is where his pain's coming from. And it has blood vessels, new blood vessels that weren't there before. And these cytokines can actually cause the ingrowth of blood vessels and new nerve fibers all the way, and by the way, also scar tissue through fibroblast growth factor. All these chemicals are being released during inflammatory process, causing these cells to come in, and then these cells do their cellular thing. For example, fibroblasts make collagen. They make scar tissue, basically. And endothelial cells make blood vessels, and nerve growth factor makes new nerves that grow into this area and tell the patient they have pain. Okay? Very, very interesting things that happen with chronic inflammation. Totally ignored by the rest of the medical community around the world. They have no concept about what's happening in these discs and why these discs are painful. Any other questions, comments?
At this moment, no current questions or comments.
I have about 30 seconds. We're just about done. Just cleaning up the last bit of this herniation and tear. Going medially here towards the midline. Going laterally now towards the outside of the disc. All right, we're going to finish this, and I'm going to move on to his sacroiliac joint. We're going to have a new stream. So let's go ahead and wrap this stream up, Henry, if there's no more questions, because we're pretty much done here.
No current questions.